It was a great discourse, and I was just amazed at how he had that capacity to embrace this system, which clearly improved the lives of Nova Scotians in a very significant way, even though in the initial stages it was not something that he had embraced. And I think that, of course, speaks to our whole system of collective and cabinet solidarity and the need to get behind government initiatives. So the point that the honourable member makes is a very valid point, that indeed significant reforms that come about very often come about as a result of being implemented by and being embraced by all people of all political stripes and people of varying backgrounds, and this clearly is an example of that. And I think he's quite correct to draw that analogy. I'm also pleased that he has drawn the distinction with respect to Medicare and the costs associated with Medicare, that for us to describe it in the use of the word free is very, very misleading, I think, and does not do the program a real service, because all citizens must place a value on the services that they receive from that program. Because without placing a value, then the system becomes ripe for people to use it in an inappropriate manner. And the expectations that arise from the attitude of it being free and the attitude of it not having a cost, we all pay a great price for that. So I think it's appropriate that all of us avoid the use of the word free, and the honourable member's not alone in having used that. I must say I had a bit of a hiccup in the middle of the Minister of Finance's speech when he used the word free in relation to this service, and it's a very important distinction to make, that indeed it is not free, and that all Nova Scotians and all Canadians pay a price for the delivery of Medicare and health care in this province. To the specific question of the Leader of the Opposition, indeed he points to a challenge that we have as a department relative to the implementation of this program over the period of the next number of months. And that does present us with a very significant challenge, because as he points out, if people decide to back away from seeking the services of a nursing home, then the services they require need to be provided in some manner or another. So it is appropriate for us to behave and act in a way that we minimize the fears that people have relative to providing these services. And while we cannot wipe the slate clean, we simply can't afford to do that, I believe that we can behave in a manner that will entice people to behave as close to normally as possible during this transition period. And the staff in the department are very much aware of that. They're very much aware of the fact that if we're not successful in doing that, that there is a price to be paid elsewhere. And indeed, it is a challenge. We're confident that we're going to work toward minimizing the dislocation relative to this challenge as much as possible. I would not be entirely forthright with the committee if I were to say there isn't a problem and there isn't going to be one. But I can assure the committee that we're very much aware of this, and we're going to work in a manner that will minimize any disruption relative to the normal flow of people seeking the services of a nursing home during this transition period. Thank you.
I will recognize the honourable member from Halifax Needham for an introduction.
Thank you very much, Mr. Chair. I'd like to draw the members' attention to the West Gallery. Is that the West Gallery? Where we're joined tonight by Mr. Morris Hickey, who is a resident in Halifax Needham, the north end of Halifax, and he's a crossing guard in our community, looking after little kids and their safety. And I'd like Mr. Hickey to stand and receive the warm welcome of the House. And I just want to say it's too bad that Bill Estabrooks isn't, or my colleague from Timberley Prospect isn't here to see the lovely Montreal Canadiens sweater that Mr. Hickey has on.
Thank you, and welcome to all our visitors today in the legislature. I'll recognize the Leader of the Opposition.
Thank you very much, Mr. Chairman. It doesn't matter if Mr. Estabrooks is here or not. I appreciate it, especially after last night. I'm going to just move along a little bit because there are a number of things that I wanted to cover, and I'm not sure that I'm going to have a chance to get back to some other things. But one of the things I wanted to talk about was that there's a graph in the budget speech that talks about the healthcare administration. And I was just curious about it because it says that in fact, I don't think it would be overstating it to say that it brags that Nova Scotia has the smallest healthcare bureaucracy in the country. That's what it says. And so I was just wondering, it says 57.85. I assume that's dollars per person. Is that right?
The Honourable Minister of Health.
Yes, Mr. Chairman, that is the figure that it's not our figure. It comes from CIHI, and it is a per capita figure, the cost of administration on a per capita basis.
The Honourable Leader of the Opposition.
Thank you. That's interesting because I was wondering whether or not the Department of Health had a figure for its administration.
The Honourable Minister
So
of
it's
Health.
a line item in the budget. We'll find it for you. The estimate for 0405 total administration for the Department of Health is 30.9 million, or 31 million to round it off, Mr. Chairman.
Thank you. Leader of the Opposition.
Can I ask whether or not that would include the administration of the district health authorities?
No, it does not. The district health authorities are a separate administrative item.
Leader of the Opposition.
Thank you. I wonder if I could just have you point out to me the page on the general kind of line item with respect to the Department of Health.
Oh, you want me to do it?
You're doing number 2.
In the estimate book. Okay, I'll find the exact. Mr. Chairman, and on the estimate book itself, and on page 12.2, there is a presentation of the administrative costs. However, you'll need a calculator to get a total. We're looking elsewhere to find just what that total is relative to those. But while we're looking for it, if you want to look at those, you can.
The Honourable Leader of the Opposition.
Sure, I'd encourage you to continue to look. One of the great difficulties with trying to examine the estimates of the Department of Health has always been around the question of what is the administrative costs associated with the department, and of course the fact that we can't find out what the administrative burden is in the district health authority, continues to exacerbate that problem. Perhaps the minister has and I see him getting advice, so perhaps he has a comment to make with that.
The Honourable Minister of Health.
Thank you, Mr. Chairman. The honourable member is correct. The figure I gave him of $31 million, that is for the administration of the department itself. I don't have a precise number for him relative to the DHA's, but it is approximately 7% of the DHA's budget is administration. So when you do the arithmetic on that, and it comes out to what? About 7 million, somewhere in that. What did I say? 70, I'm sorry. 70, yeah.
Thank you. The Honourable Leader of the Opposition.
So that would put the overall administrative budget somewhere around $100 million. And again, I find it every year. I try to look at these things, and every year I find it frustrating. I just want to explore, maybe if we can, just a little bit about this. When I go to the doctor's office and they ask me for my health card, how does that get charged to the system? How does that actually happen?
The Honourable Minister of Health.
The payment to doctors comes under the category of medical payments, so it would be part of that budgetary item.
The Honourable Leader of the Opposition.
And I certainly understand that much of it. What I was wondering was just exactly the route of the money from the Department of Health through to the doctor, because you have an administrative capacity within the department, but the reality is that you don't actually handle that money. I mean, they're not sending you an invoice and you're not writing a check and sending it back. Isn't that the case?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And I'm not sure if this is what the honourable member is looking for or not, but when you go to the doctor's office, each procedure or service that is provided by the doctor has a specific claim or claim number to it. The doctor would submit that to Atlantic Blue Cross Corporation, and Atlantic Blue Cross would then submit a payment back to the doctor. We, of course, through the Department of Health, through medical payments, provide Atlantic Blue Cross with that money that's used to pay the doctor.
The Honourable Leader of the Opposition.
Thank you. Well, now we're getting somewhere, because that's exactly what I was wondering about. Because what I was wondering about was, how does the administrative costs of Atlantic Blue Cross get reflected in your budget or in your calculation of administrative costs? So the money that you pay to Atlantic Blue Cross to administer the medical payments, are they accounted for, I'll start this first, as administrative costs in the Department of Health?
The Honourable Minister of Health.
It is? It is a number that's included in the $31 million, and it's approximately $8.7 million.
The Honourable Leader of the Opposition.
And is that broken out somewhere in the estimates?
Minister of Health.
I'm told that is included in the, in the chief, it's part of the chief finance officer on the line item in the supplementary estimates. Is that right? Okay. That's,
Leader of the Opposition.
So it would be included in the $12 million line item under the CFO's. Okay. I noticed, and curiously, that at the end of the estimates, there is something called funded staff, and there's a whole list of funded staff, and which include people in the CFO and in the Chief Information Office and all of that. Is there a reason why that's broken out, or are these numbers? I mean, they appear to be broken out separately, so I assume that they're not included in the other line items. Is that a fair assumption to make?
The Honourable Minister of Health.
the item to which you refer is provided for information so that you have an understanding of how many people there are working in various parts. But the money that's used to pay for them is included within the budget items. Okay?
And these are full-time equivalent.
The Honourable Leader.
Yeah, they're full-time equivalents. Okay.
Leader of the Opposition.
Thank you. So 16.1, for example, in general administration is the number of FTEs that are assigned to the Department of Health General Administration, is the way I understand that, and I see that the minister is nodding. So I'll because he's in agreement. That's right. So I understand. I now at least understand why that was broken out separately. As has already been raised with the minister outside the House, there was considerable interest in the fact that one of the line items in the general administration that was increasing, and I assume that this would be included in the overall administrative budget, was the whole question of communications, which went from $494,000 last year to some $622,000 being forecast next year. And I know that the minister was asked, how many people there are in the communications department of the Department of Health, and I didn't have the benefit of that answer. So perhaps he could tell us and tell us why it is that at the communications department continues to grow, quite significantly, and at a time when, of course, that money could be used in the Office of Health Promotion or could be used in other initiatives within the department.
The Honourable Minister of Health.
Thank you, Mr. Chairman. The question relative to the increase in that budget, which just over 100,000. One part of that is to make provisions for the report to Nova Scotians that we've committed to putting out as a follow-up to Your Health Matters on an annual basis. And for the information of the House, I just want to point out that particular report was done completely by the staff. They did all of the writing, editing, layout, getting ready for the printer and everything. That was all done in-house, and so the staff did all of that work. We didn't contract any of that out. the costs, and we would plan to do that in the same way next year, and the costs associated with the publication then are for the printing costs and for the distribution costs relative to it. We also have a maternity leave which is reflected in those numbers, and the breakdown of employees, many of the employees are employees of Communications Nova Scotia, even though they are charged against our department. Okay, so we have, in terms of that breakdown, there are 4 Communications Nova Scotia employees and 3 employees of the Department of Health.
Thank you. The Honourable Leader of the Opposition.
And when you talk about those employees, are they directly communications staff or are they administrative staff?
There's one position is the secretarial position, and the other 2 are communication staff.
Thank you. The Honourable Leader of the Opposition.
Thank you. Thank you very much, Mr. Chairman. I'm going to move along because, again, I don't have a lot of time to deal with this, but I wanted to go to 12.6 in the supplementary detail, and there's net program expenses, acute and tertiary care, and there's 2 line items there: acute and tertiary care administration, which I assume goes into the general calculation of administration in the Department of Health, and the next line item, which is acute and tertiary care management. And I was wondering if you could explain what the difference between those 2 line items are, and whether or not the management side is calculated as part of the general administration budget, or as part of the, rather, administration budget of the Department of Health.
The Honourable Minister of Health.
Book out, you're at the supplements, so just give me a minute to. Thank you, Mr. Chairman. The 2 items really relate to the fact that there is one that is purely administrative in nature, and that's acute and tertiary care administration. The other is the management who actually carry out and deliver the programs of the department. I see I've not not answered the question fully.
Minister, the Honourable Leader of the Opposition.
So you're saying that these are doctors who actually do the delivery? I don't think that's what you're saying. I just want to know, why it is that they're distinguished. I guess the first question is, are these included in your calculation of administrative costs? And secondly, if not, what it is that you use as the defining line between administration and management.
The Honourable Minister of Health.
First of all, both items are under administration. Okay, the administration budget of the department. The first item would be the executive director and her staff, but the other are those who establish the standards and monitor the standards of care as they're being implemented, and that's that more or less is how it works. They report to the administrators as such, but they develop the standards and ensure and monitor the implementation of those standards.
Thank you. The Honourable Leader of the Opposition.
Thank you. I'm just going to go through and check these off, and you can stop and tell me if any of these are not included in the administration of the Department of Health. And I'm going to just start on 12.3, which is really of the supplementary estimates. And I'm just going to read off some of these, and if there's something in these after I finish that is not included in administration, maybe you can tell me. Obviously, general administration, which is the first one, the chief financial officer, which is the second one, and all of the services supporting the chief financial officer's office, the chief information office and the support for that office, the chief health human resource office, which is we've had some discussion about, the chief policy planning and legislative office, the associate deputy minister, the acute and tertiary care, the continuing care. Population health doesn't have anything in it anymore. The quality emergency health services and health protection items, primary care, the mental health program, and we're going to just stop there because I want to, for now, and see if there are items in here that don't fall, up to 12.8, that don't fall in the category of administration and what they would be.
Thank you, the Honourable Minister of Health.
I understand, Mr. Chairman, that if you were to take the total of all of those sums and put them together, you would get the $31 million. So they're all part of administration.
The Honourable Leader of the Opposition.
So all of those that's what makes up that $31 million cost. And so in the medical payments, which is the next item, there is nothing in the medical payments that would be considered of administrative nature. So this is a straightforward payment directly to physicians. Is that right?
The Honourable Minister of Health.
That's correct, Mr. Chairman.
Leader of Opposition.
Now, I wonder about this, and I wonder about when we make the payments to physicians. Physicians, of course, are in the business of running their own offices, right? And they would pay their own administration out of those payments. Is that correct, or am I misunderstanding how that works?
The Honourable Minister of Health.
Yes, that cost for the office of the physicians is embedded within the tariffs that are paid. That's correct.
Leader of the Opposition.
I assume when you're doing your overall planning that you'd have a look at that. Do you know what percentage of those payments go to support the administration of that program?
Thank you, the Honourable Minister of Health.
The overall answer to the question, Mr. Chairman, is that yes, but each tariff item has a separate administrative element associated with it, and it's going to be different for each one of those. I don't have all of them available here, but we could certainly attempt to make that information available to the honourable member.
Thank you, the Honourable Leader of the Opposition.
Well, if the minister would make that undertaking to provide me with that, I'd be interested to see it. But I mean, just over, and I see if I have this right. Now, overall, the medical payments, what they are is they represent the overall cost of delivery of a number of different kinds of procedures that might be done in the office of a physician. And I think what the minister was saying is that depending on what service the physician's actually supplying, the administrative allowance that goes along with that charge is different. One assumes that they use more of the resources of the individual physician. But I mean, this is a day and age when we have computers, we have complicated accounting software. I know that in fact, the Auditor General has said that they need to hire and contract out specialized staff sometime in order to be able to review and audit books. But I'm assuming that when these items are sent out and determined, that actual breakout takes place at the Department of Health level. Like, you actually know when you're sending the money out how much of it is allocated. I mean, maybe the physician spends more on administration, but only so much of it can actually be allocated for administrative costs. Is that right? And is that what the minister is undertaking to provide us?
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. The amount of money that's at question here is something that is predetermined as a result of the negotiating process. And so once the agreement is in place and the money begins to flow, then each service has an administrative element to it. And that is what we would undertake to make available to you.
Thank you. Leader of the Opposition.
Okay, just so that the minister and I are on the same wavelength, what I want to know in cold hard cash is how much of the $511 million that's allocated goes to administration at the physician's office level, and I'm understanding that this is from the perspective of the Department of Health. In other words, there's a tariff, and you pay on the basis of tariff. Whether or not the doctor in his office pays more or not is up to him. What I want to know is what the dollar figure is that the Department of Health feels that it's paying in administration for that line item.
Thank you. The Honourable Minister of Health.
Mr. Chairman, what we will do is, and the honourable member is correct to point out that it is a predetermined fee that flows to the doctor. How he or she decide to spend it is up to them. But what we will provide you with is that element of the fee that is presumably dedicated to or identified as being an administrative charge.
Thank you. The Honourable Leader of the Opposition.
Okay, I want to move on now to the pharmacare program, and what we will see here allocated is about $103 million in the pharmacare program, and do the pharmacare payments, is this purely the cost of the drugs, or is there, as there is with medical payments, an administrative cost associated with the way in which those drugs are delivered to the patients? I mean, who administers the program, and how is that accounted for within the $103 million?
The Honourable Minister of Health.
Included in that number is the dispensing fee to the pharmacists, and that's how they are paid, so it's part of that cost.
The Honourable Leader of the Opposition.
And does the minister know what, in dollars, how much of that $103 million is in that dispensing fee category?
The Honourable Minister of Health.
Thank you, Mr. Chairman. The amount is determined as a percent of the value of the prescription that is dispensed. I don't have the exact number with me, but we'll take note of that and make it available to you.
Thank you. The Honourable Leader of the Opposition.
Thank you. I guess I'm going to continue on with this, but I guess my point is that in each one of these services, buried within them is an administrative component, which I'm betting, and I just, you know, as an observer, but I'm just betting that that's not included in the $57.85 per capita that is included. Now, as you say, you didn't manufacture this number. It came from CIHI, and no doubt we'll have to have a closer look at exactly what they count and what they don't count if we want to find out the answer on health costs, just simply because it seems so incredibly out of whack with what's going on in administrations of similar size. So I'm sure that's something that we'll be able to track down, and I don't mean to ask the minister to explain that. Under other net program expenses on 1210, there's a whole list of payments that are made, including, for example, the children's dental program. Can I assume, or should I assume, that there are also administrative costs reflected in each one of those items as well?
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. Under the item referred to by the honourable member, all of the administrative charges to those programs are covered under the fund we discussed earlier, the finance administration, except for the children's dental program, and there is an administrative fee paid for that. That's separate.
Thank you. The Honourable Leader of the Opposition.
I just have, on an unrelated subject, but I only have a couple of minutes here, so I want to get this in because it's been a question that's asked of me, and that has to do with those individuals who are currently at Sunrise Manor and who were previously in the rehab center, and who I believe, when they were sent to that facility, were told they were going to be there on a temporary basis for a year. Well, I think it's been something in the order of 2.5 years. There has been some considerable objection with respect to that program by a lot of different people with interests in caring for those individuals. I wonder if the minister could explain to us the state of play there now, and what, if anything, is going to change.
Thank you. The Honourable Minister of Health. Your time is
Mr. Chairman, with the indulgence of the honourable member, in the interests of providing as accurate an information as I could, I'd appreciate it if you'd allow me to come back to the committee at a later date with the update on that information.
Thank you, Minister, and the time has been used up for the NDP. I'll now move to the Honourable Member for Glace Bay.
Thank you, Mr. Chair. I will say at the outset that I intend to make more than a few comments, so the Minister can relax for a little while. And then I'll get to some line-by-line items later on if we have the time, and if not, we'll save them up for another time. Mr. Chair, it's been interesting the way things have started during the budget estimate debates on health. First, we had a rather thoughtful and educated lesson on procedure here in the House of Assembly by the Minister, who I'm impressed knew most of the rules regarding when we go into Committee of the Whole. He even knew where the mace goes. So I was impressed by that at the beginning, and certainly I'm impressed with both the knowledge of the Leader of the Official Opposition and the Minister on the history of Medicare in Canada. And so it's been a lesson in just sitting back and learning about some of those things for me, Mr. Chair. So I thank both the Minister and the Leader of the Official Opposition for enlightening me on those matters right now. And I mean that in all seriousness, because, you know, sometimes it's good to hear from veterans of the legislature, such as the Minister of Health. They've been around for a very long time. And occasionally it's even good to hear from the official leader of the opposition. Occasionally, I should say, Mr. Chair. But I'm pleased to rise in my place on behalf of the Liberal caucus and to begin our debate on the estimates of the Department of Health. But before I begin a certain line of questioning, then it would be rather remiss of me if I didn't take this opportunity to perhaps get out some general thoughts and concerns and opinions about the healthcare system and what was contained and what was not contained between the lines of the health budget. A budget, as we now know, a health budget that is to the tune of $2.3 billion, or 40% of the total budget of the province of Nova Scotia, which is worrisome in itself, Mr. Chair. And the statement, I guess, that comes to mind, and certainly I would say at the outset that certainly my comments are in no way directed towards Department of Health staff at any time. I hope that they're not slighted or offended by anything I might say. I certainly am quite aware of the hard work of the Department of Health staff that goes into estimates and budgets and planning on a year-round basis. But Mr. Chair, in all fairness, on behalf of, what has not gone into this healthcare budget on behalf of this government is a lack of planning that exists within healthcare in this province, Mr. Chair, and it immediately comes to mind when one looks at the health estimates, Mr. Chair. In 1999, it was this government that said healthcare did not need any more money. Those were the words of Premier John Hamm, that in Nova Scotia, healthcare did not need any more money. It just needed better planning. That's the words of then and still Premier John Hamm. And 5 years later, Mr. Chair, we find that, the figure is over $574 million later. No indication that the system is or will be better. Ask the people who are working in the system, ask the people on the front lines, ask your frontline healthcare workers who are working in a system that is clogged and at the end of its wits on a daily basis, whether or not the system is better. And most importantly, we don't know if it will be accessible to Nova Scotians when and where they need it. Now that, Mr. Chair, has to be one of our biggest concerns, whether or not Nova Scotians can access their health care system. But yet, Mr. Chair, the government seems to be very proud of itself, and they're able to say and boast and brag and come up with a figure of $231 million more that they're pouring into health care in Nova Scotia. Well, Mr. Chair, and to the Minister, I would suggest that this is a very disturbing public relations exercise on behalf of the government. Because, Mr. Chair, a lack of planning on the part of this government is severely threatening what is the sustainability of our healthcare system in this province. And, Mr. Chair, through you to the Minister, I cannot stress, and yes, to the government as well, to the government in general, and to the members of the New Democratic Party, we'll remind them as well that the sustainability of our healthcare system is in deep trouble, very deep trouble in this province. Mr. Chair, you may or may not be aware, I hope you are, that we had a caucus roundtable in the Liberal caucus. 2 members, of which I was one. The other one was the member for Kings West, who traveled around the province meeting with healthcare professionals, and we met with administrators, we met with the general public on our roundtable on wait times. And we went from one end of this province to the other. I was particularly struck by the comment made at one public meeting, which went something like this, Mr. Chair, that pretty soon, the person said, pretty soon in this province, you'll have a Minister of Health and you'll have a minister responsible for what's left over in this province if we keep going the way that we're going. It's the first message, Mr. Chair, that flashed through my mind when the estimates for the Department of Health were tabled. We're not far. We're not far from that right now. When you start looking at the Department of Health taking up 40% of the overall budget, and you start looking at just over $2.3 billion with only an 11% increase, Mr. Chair, we're not far from that now. And sadly, Mr. Chair, you know, thanks to poor planning on the part of this government, then perhaps that the day of collapse, although I hope we never get there, but perhaps the day of collapse is coming sooner than we all think. Mr. Chair, without what have to be fundamental investments in certain key components of our healthcare system, the entire system is indeed in danger of collapsing on itself. Mr. Chair, it is not acceptable for government to say that they are spending more money on health. As a matter of fact, Mr. Chair, if you take a look at the most recent report in this country, what everyone is looking at now in the Romano report, indeed, Mr. Romano recommended that there be a plan in place, that there be a concrete action plan in place before any more money was thrown at health, as it continuously is. It's not acceptable for a government to say they're spending more money on health. They now have to demonstrate that they're investing in the right areas of health care in this province, and that's irrespective of where they live or the type of health care that people need or if they're able to access it in a timely fashion. Mr. Chair, I've said in this legislature before, and I will say it again, and I'll probably repeat it in the not-too-distant future, that, as I mentioned, the roundtable sessions that we had on healthcare wait times throughout this province have been, for me, and I'm sure for my colleague from Kings West, an invaluable lesson, invaluable learning experience, Mr. Chair. And the lessons that we learned on the road have led me to the conclusion that indeed this budget and this healthcare budget, they are a long way from being a cure for the healthcare system. Mr. Chair, the budget tabled in no way, shape, or form begins to address the challenges and gaps that we heard about as we traveled from one end of this province to the other. Let me start, for instance, Mr. Chair, in the Annapolis Valley, and we met with an organization there that is attempting to bridge a gap in service by trying to establish a hospice for palliative care patients. This group has made its way through the bureaucracy, Mr. Chair. They were asked by the department, they've been asked to develop a financial and administrative structure, and they have yet to receive a response. Mr. Chair, the day that we visited Valley Regional, there were 12 palliative care patients at the Valley Regional. A 10-bed hospice that was being proposed would reduce the burden on the Valley Regional Hospital and would ensure better quality care for those who were looking for palliative care. And Mr. Chair, let's not forget that when you talk about health care and how expensive health care is, you're talking about a per diem cost of about $1,100 plus at Valley Regional. compared with around a $400 per diem at a hospice. Better care at a reduced price. And you decrease the burden on the Valley Regional Hospital. So if you just take a look at that one equation, Mr. Chair, I suggest it sounds rather logical. It did to me, and I'm sure it would to the Minister of Health as well. Now, Mr. Chair, let me give you another example. We have the emergency department where on the day that we visited, there were 7 or 8 patients in a 15-bed emergency department. They were waiting for a hospital bed. So the challenge for the hospital bed there, Mr. Chair, like virtually every other hospital across this province, is a flow of patients. One must be reminded, Mr. Chair, that the problems that we hear so much about, for instance, at the Queen Elizabeth II Emergency Department in the Capital District, is just not unique, unfortunately, to the Queen Elizabeth II. Those problems are being experienced on perhaps a smaller scale, but just as big in terms of the effect that it has on the hospital, at hospitals across our province, and we found that to be the case in hospitals and emergency rooms that we visited across the province. Now, Mr. Chair, we hear that governments say that there will be 85 long-term care beds. But, Mr. Chair, with this government, you have no idea as to whether that is going to incorporate what has already been announced or whether there are 85 brand new beds that are going to be in the system. And if we look at the budget, you would gather that a large number of those nursing home beds have already been announced and will be re-announced again sometime soon. So, again, at the Valley Regional, the ability at that hospital and at the other hospitals that we toured throughout this province to improve the flow of patients in their facilities may or may not be addressed in this budget. Mr. Chair, the day that we visited the Valley Regional, the facility was forced at that time to use mandatory overtime for the second time that week. The only other option would have been for them to call all of the referring hospitals and to tell them, would you please stop transferring patients at this time. Mr. Chair, that type of decision is not an easy one. Do you force nurses to work overtime to open up more beds, or do you tell other hospitals that you're unable to deal with the healthcare needs of a patient that is being referred? And certainly, Mr. Chair, for the healthcare professionals, that's the type of stressful environment that they certainly don't need. It's an extremely poor work environment, and it certainly would do nothing. For instance, if you were looking for an assist in recruiting efforts for specialists or so on. Mr. Chair, the inability of this government to appropriately plan for and then address the needs of long-term care is actually paralyzing our acute care system in this province. It is, Mr. Chair, I must say, most welcome to see the government cover the health care costs of long-term care. The inability of this government over the past years to adequately meet the needs of long-term care patients. And Mr. Chair, let's not forget that we see no mention of a plan to deal with our aging population as well. That's another segment that's missing. But to adequately meet the needs of the long-term care patients will put a significant strain on this system over the past several years, a strain without a plan from this government. And yes, Mr. Chair, I am as glad, and my caucus is as glad as any other members in this legislature to see that a combined effort by opposition parties put enough pressure on this government to move up the timetable to 2005. And perhaps that is a prime example, a shining example of how a minority government should work and how opposition should work, regardless of who gets credit for coming up with the idea in the first place. And I must say, Mr. Chair, that it was the government that did move and say we're going to make this plan effective in 2007. And if that's what it took, was a combined opposition effort to say move it up to 2005, maybe we fell short of doing our job when it should have been moved up to 2004. And maybe we should have pushed a little bit harder, but not going there and giving the appropriate credit where it should be to the minister and to the government to finally move that up to the year 2005 and do exactly what should have been done and cover the health care costs of long-term care patients in this province. Mr. Chair, let's go to the issue of home care. And it was interesting when we asked the professionals, again at the Valley Regional Hospital, we asked the role of home care when it came to actually discharging patients. Well, Mr. Chair, do you want to know what we heard? I'm sure you do. We heard that it sometimes takes the hospital up to 2 days. 2 days to discharge a patient because that's the amount of time that it takes for home care to get straightened away. And that's 2 days, Mr. Chair, that particular patient will be occupying a hospital bed. It's 2 days when a patient could be in the comfort of his or her own home, but they're not because of the challenges that are being experienced in home care. It's one of the keys, in our opinion, Mr. Chair, to where health care should be going in this province, but we're not there. We're not even close in terms to what should be done in home care. Mr. Chair, it remains to be seen whether that $231 million increase in health care and spending will provide support for a better resourced, more enhanced home care program. I doubt it, because, Mr. Chair, in all honesty, that would require a plan. Again, it's not something that we've seen from this government. Mr. Chair, there is the issue of, again, in the Valley, and I know I'm using the Valley for a lot of examples. We had some great meetings there in that area, in that region, and we heard from a lot of people. There's the issue of women's health, for instance, in the Valley region. There is an 18-month wait for gynecological surgery, with 110 women with serious health conditions in the Valley area that are on a list waiting. Mr. Chair, I would suggest to you that kind of a wait list for that kind of health care in this province, in any area of this province, is totally unacceptable. We also heard from a person by the name of Sean Trahan, is his name, a young man from Aylesford, and we told his story here before in the legislature. 2 years, he was told that he'd have to wait for surgery. It would take 2 years for him to get surgery on his foot. Now, unfortunately, Mr. Chair, Mr. Trahan's disability benefits were running out, and his 5 children, that's correct, he was faced with what he would consider a decision that surely no one should ever have to make. And the decision was whether he should actually go ahead and have his foot amputated so that he could go back to work and feed his children, his family. Mr. Chair, what we learned is that people who are waiting are numbers on a chart or on a graph or on a list that someone is looking at. What we seldom hear is what that wait process does to people. We seldom hear about deteriorating health, about the mental anguish and the pain, all of those things that this government, if they ever get around to producing an actual wait list, would be able to quantify. We know that the issue of wait lists are being studied. It's been studied for years now. We knew the problem existed, with the exception of the former, now departing Deputy Minister of Health, who has never admitted in this province that there was a problem with wait lists, on about the same level of acceptance as saying that there's no problem with prescription drug abuse in Cape Breton, but that's another story for another day, and I'll eventually get there during estimates or whatever the case may be. But it was the departing Deputy Minister of Health who said that he didn't see a problem with wait lists in this province. But we know there is. Every Nova Scotian knows that there is. Every Nova Scotian or their relatives or friends or children who have ever waited in an emergency department or have ever waited to have surgery done, who have ever waited to even get a family doctor, knows that there is a real problem with wait lists and wait times in Nova Scotia. Now, what we see in this budget is $465,000 on a budget line item to monitor wait time lists. But where are the lists that are going to be monitored? Why isn't government sharing those lists with the general public, with us as an opposition party? And what are the action plans that are there to deal with these lists? Mr. Chair, what this government has failed to realize that to deal with wait lists, first of all, you have to deal with the health care system. You just can't keep shoveling loads of money into acute care when the system can't sustain what it has now because there is either insufficient support for home care or long-term care, and again, Mr. Chair, there is no plan. That has been identified by many experts. And it's been identified by just some of the anecdotal evidence that we gathered, Mr. Chair, on our roundtable trip across the province. Everyday Nova Scotians would tell us it doesn't have to be hundreds of millions of dollars to solve the problem. There are common sense solutions to some of the problems that are facing health care, but time and time again we were told no one is listening to us. No one is paying attention. And if they did, then, Mr. Chair, those people were telling us there would be an appropriate plan in place, and we'd be able to solve problems like what we see happening at the QE2 emergency department and what we see happening at other emergency departments across the province.
Order. I'd like to recognize the Government House Leader.
I was wondering if the honourable member from Glace Bay would adjourn the debate momentarily so we can return to the House to introduce a bill.
Would the member agree to that?
Mr. Chair, I would so move to adjourn debate.
Thank you.
Rise.
Mace.
Order, please. Recognize the Honourable Government House Leader.
Speaker, with the consent of the House, I'd ask to return to the order of business, introduction of bills.
Is it agreed? Agreed. Order of business, introduction of bills. The Honourable Minister of Finance.
Mr. Speaker, I beg leave to introduce an act respecting certain financial measures.
Hear, hear. The Honourable Minister of Finance begs leave to introduce a bill entitled An Act Respecting Certain Financial Measures.
Bill 62, entitled An Act Respecting Certain Financial Measures.
This bill be read a second time at a future date. The Honourable Government House Leader.
Speaker, I move that you do now leave the chair and the House resolve in the Committee of the Whole House on estimates.
Carried.
we'll recognize the honourable member for Glace Bay.
Thank you, Mr. Chair. Where were you? I remember exactly where I was, so I'll just continue from where I was, Mr. Chair. As I said, it's easy because the whole concept of what I'm trying to get across here is that there's no plan. So if you refer back to the fact that there is no plan, there is no plan, there is no plan, then that's exactly where we pick up from where we left off, Mr. Chair. Mr. Chair, I was talking about wait lists, and in particular, I also mentioned long-term care and home care. Mr. Chair, in Capital District, during our tour of the province on wait times, we made a stop at the Capital District, in particular at the QE2 there. There were 142 patients the day that we were there were waiting for long-term care beds the day that we visited the area. 142 patients. 15% of the beds were occupied with patients who can be cared for in other facilities. Wait times, Mr. Chair, in this province for the elective CT or a CAT scan are increasing. Emergent radiotherapy treatment wait times were increasing. Surgical cancellations were up because of no beds. Yet at that time, there were 142 beds were occupied with long-term care patients. In every facility that we visited across the province, long-term care beds were identified, not by us, Mr. Chair. They were identified by the healthcare professionals, the administrators, the nursing professionals, the doctors, the chiefs of staff, whatever the case may be, whomever we talked to at those facilities. At every facility across the province, long-term care beds were identified as one of the major problems facing those facilities. We traveled to the Cobequid Multi-Service Centre. We made a stop there as well. A centre that, to my surprise, serves a catchment area of about 100,000 patients. You know, I was absolutely amazed. 100,000 patients. An absolutely wonderful facility, excellent staff that was there. Only problem, it closes at 10 o'clock in the night. One of the other problems that they tell us there, Mr. Chair, was that they, will put patients into an ambulance to transfer to the QE2, whatever the case may be, and when they get to the QE2, they're in a lineup of ambulances trying to access services at the QE2. So, Mr. Chair, the minister perhaps could be asked, does your budget provide for 24/7 emergency service at the Cobequid Centre? Is that going to be there? Now, Mr. Chair, there's also a case, let me give you another example. There's the case of Mrs. Edith Power, who has been waiting since the year 2001 for a hip replacement. Her pain has been, as what she describes as just constant pain. Her wait, totally unacceptable in this province if you're waiting since 2001 to have a hip replacement. And then, Mr. Chair, from a general surgeon in Halifax came the news that last year at the QE2, 25% of surgeries last year at the QE2 canceled. Not done. In 2001, there were 2 operating rooms that were closed as a result of budgetary restraints or constraints, and they remain closed today. Does this budget address that situation, Mr. Chair? We heard from an employee at the Nova Scotia Hospital, and this particular employee spends 50% of her time trying to find a hospital bed for a mental health patient. Not uncommon, Mr. Chair, to find a patient from Halifax end up in Cape Breton in this province, far away from the one source of support that they need most in the time of that sort of crisis, that being their family, Mr. Chair. We found in every center that we visited across this province mental health concerns were at the top of the list of concerns, whether it be accessing emergency departments or just accessing the mental health care that was required by patients. We found mental health care patients that were triaged medically within a certain amount of time, but then waited 8, 10, 12 hours in emergency rooms to access any kind of mental care whatsoever, a psychologist, a psychiatrist, which is unheard of in some areas, Mr. Chair. Mental health, which is the forgotten healthcare component, I would suggest, Mr. Chair, and was mentioned in every roundtable discussion that we had in this province, is once again totally, absolutely, and wrongfully forgotten by this government. There are some communities, Mr. Chair, in this province where it is not uncommon to wait 3 weeks to see, for instance, a family physician. There are caseloads, if you're lucky enough to have a family physician, there are caseloads, for instance, in Yarmouth. There are caseloads in Yarmouth per doctor that can number from 5,000 to 6,000 people per doctor. Mr. Chair, let me raise the subject of community health clinics and the question of whether or not are there any resources allocated for community health clinics in this province? What about resources for doctors' offices that would enable them to stay open, let's say, on weekends and in the evening? Resources have been allocated, just not this year. So, Mr. Chair, for emergency rooms that are coping with an influx of patients who are unable to gain access to either an office or a doctor, carry on, this is what the budget is saying, carry on operating as you are. There are no resources in the medical agreement to deal with level 4s and 5s that visit ERs until the year 2006, 2007. Let me give you a personal experience. Unfortunately, about 2 or 3 weeks ago, and I think everybody in this province so far has contracted this viral infection that's going around that leaves you with coughing fits, you know? Anybody had it? It's not pleasant. It's not life-threatening. And you certainly don't require, and I hope the member for Dartmouth North doesn't get it. But it's not pleasant and it's not life-threatening, as I said. But let me give you my personal experience. Here I am in Halifax one night, and it's one morning, about 4:45 in the morning, and I can't stop coughing. No, I don't smoke. But it's a nice try from the Minister of Education. I'm coughing and coughing and coughing and coughing. And I can't sleep, I can't do anything, and eventually I'm growing short of breath. I'm not from this area. My family doctor's back in Cape Breton. I have no idea, unfortunately, although I've researched it since, where the community clinics are. And I'm desperate. So I'm going to make a trip to the emergency department at the Queen Elizabeth II at 4:45 in the morning. And I get there. And I go into a triage room, and there are 3 paramedics there. And I'm triaged right away, blood pressure taken, and your temperature and so on is taken, and then I'm put over to the sign-in area. I'm looking for the word, but I'm missing it right now, where you register, the registry area. I'm taken care of, and I'm put out in the waiting area. Good day. Have a nice day. 8.5 hours later, I've finally seen a doctor. I've had an x-ray, and I'm told, Mr. Wilson, go home. You have a viral infection, and there's nothing we can do for you. Which certainly is not anyone's fault at the QE2. It's a viral infection, and there is no medicine available for a viral infection. You pretty well have to let it work its way through. I did get an x-ray, and I was comforted that I hadn't contracted pneumonia, whatever the case may be. But for myself and the others that were there in the waiting room, and there were others there who would have been probably diagnosed with the same level of treatment that I was diagnosed, I would have been at the bottom of that triage system, the 1 to 5 scale that they use. I would have been a 5. So I'm expected, it's become quite the norm in this province, that you will wait anywhere from 8 to 10, 12 plus hours in an emergency department, because really what the healthcare system has said right now is that you shouldn't be here in this emergency department. You have no place in this emergency department. You're not sick enough to be in this emergency department. And heaven knows, and they did that day at the QE2. They did that day. Every booth, every bed, every stall was full at the QE2 that day, and doctors and nurses were running off their feet. And certainly because of my illness, which was on a very, very, very low scale, I'm not even suggesting that they should have been running off their feet to look after me. They had much sicker people there. But what I'm asking is that in this province, in our healthcare system, where else do those people go? Not just me. Where does the mother with a child with an ear infection, who can't get to sleep in the middle of the night, who has no community clinic, who has no doctor's offices open, where does that mother take her child? To an emergency room. Because we have nothing else in this province to offer them whatsoever, except come to an emergency department and wait for hour and hour and hour on end. And maybe you'll be lucky enough to see a doctor. That day that I spent 8.5 hours, believe me, through no choice of my own, I would have rather been at 100 different other places, although the staff and the doctors were excellent. Believe me, on that day, I saw people leave that emergency department because they were so frustrated and exasperated with what was going on, they just couldn't cope anymore. These are sick people, maybe not at the top of a triage scale, but they are sick people that left this hospital without getting any treatment whatsoever because of the system that we now find ourselves in. Now, at that same day, there was what I assumed to be a volunteer who was in charge, who came in around 7 o'clock. I think I had a waking moment at about 7 o'clock as I was sitting in the very comfortable chairs in the QE2 department. Well, maybe not that comfortable. I wasn't in the comfort room there. I was just in the emergency room. But as there was a volunteer that day who was actually going around checking names to see whether or not you were in next or whatever, and I was getting a little bit tired at about, I don't know, it was about maybe 8:45 or so, a little frustrated, and I asked this gentleman, and he said, well, don't go yet, you're next. And so I did. I sat down and waited about another hour or so before I got in. Next in the emergency department is measured not in minutes, it's measured in hours, not in minutes, unfortunately. So that's my personal experience, Mr. Chair, and I tell the minister about that because I think it's indicative and I think it's an example of what is happening many, many hundreds and thousands of times across this province of people who are trying to access a healthcare system which is totally inaccessible to them right now under the circumstances that we find ourselves in Nova Scotia. It doesn't matter whether it's in Halifax, whether it's in Glace Bay or Digby or Yarmouth. It doesn't matter. What we have found is that if you are using an emergency room as your prime source of health care in this province, then you are in trouble. You're not in trouble because of the staff that works there or the resources that are there or the doctors that work there. You're in trouble because it may just not be accessible to you right now in this province because of the numbers of people who are trying to use it or because it may or may not even be open. And I've raised that now in this legislature for the last 5 years, that in some areas, including my own, it's still not a certainty if you go to the emergency department in the first place whether or not that emergency department is going to be open. Because you could run into the problem of doctor shortages, which still exist to this day and age in Nova Scotia. Mr. Chair, as I said, so that's an example of how emergency rooms are coping with an influx of patients who are unable to gain access to an office or a doctor and so on. Now, Mr. Chair, let me change my train of thought for a minute and go to the subject of information technology and the need to be able to access information pertaining to diagnostic testing and patient history so that we can avoid duplication and hopefully will avoid error in the system as well. This was an issue that came up at every site visit that we had with our roundtable on wait times as well. The power this system would have to address the issue of wait times, Mr. Chair, is enormous. The resources and support needed to make it a reality, however, by this government is somewhat dubious. Mr. Chair, past information technology budgets have been overspent. The project has been delayed, and we'll need to hear from the minister when we get into the detail and get into the meat of the budget estimates. We'll need to hear from the minister why the project has been delayed. When are we going to see some progress here? How do you plan to train nurses and other healthcare professionals on the system? When do you plan to do so? All of those, I would suggest, legitimate questions, Mr. Minister, which you'll get the chance, hopefully you'll get the chance to answer at a later time. Mr. Chair, then came the overwhelming support that we heard in every community that we visited, in every community meeting that we attended, to provide resources for health promotion programs. Everywhere that we visited, we've heard firsthand of their support. And I would again be remiss, Mr. Chair, if I didn't tell the minister, if I did not tell him that this is an issue where, in this case, the people are ahead of the government. And never since the issue of smoking in public places, never have I seen a component of health care where the desire of people to see more support in health promotion program actually outweighs that of the government. And unlike smoke-free places, Mr. Chair, where this government failed to meet the expectations of the public, this is an area where people are demanding that the government pay some attention. But sadly, Mr. Chair, with an increase, as the Minister of Health Promotion knows, with an increase of $25 million being collected in tobacco taxes, the public sees a $3.6 million investment towards health promotion. And it seems, I would suggest to anybody who would take a look at that and keep an open mind, that that would seem like a bit out of balance, Mr. Chair. If this government does not begin to address in a meaningful way, the area of health promotion, we will always see unsustainable increases in acute care. We will always see a sicker population, and there will always be, Mr. Chair, nothing but a crisis looming ahead. Now, we are, Mr. Chair, happy to see an increase in health promotion of that $231 million extra for health care, which was a mere 1.5% of it that went to health promotion. The figure was, am I correct in saying 500,000? No, sorry, the minister, the $3.6 million, sorry, off track, $3.6 million. But Mr. Chair, as long as we see spending allocation that out of a total budget is that small, we'll always see acute care budgets increase and a system that's unable to meet the needs of Nova Scotians. I've been told, and can't recall the exact person who told me this, but I'm told that in this province it costs approximately $250,000 an hour. Is that correct? $250,000 an hour to run the healthcare system? Pardon me? I think that's approximately right. That's a staggering number when you think about it. You know, how can we continue to keep feeding that kind of voracious beast that's going to eat $250,000 an hour? We have to find other ways, Mr. Chair. The minister, I think, Mr. Chair, would like the people of Nova Scotia to believe that the health care budget has increased, and because of that, everything is going to get better. Mr. Chair, again, it can't get better without a plan. And that plan has to encompass the entire health care system. This budget is not going to lead to better health care in this province. It can't happen without a plan. Mr. Chair, before I can continue, can I ask you just exactly how much time I have left, please?
You have till 5:51.
Thank you very much. Mr. Chair, this budget, as I said, won't improve health care in this province. It certainly won't improve the flow of patients in this province. This budget continues to put money into hospitals without providing resources for those components of the healthcare system that keep people out of hospitals in the first place, and that enables patients to leave hospitals for other levels of care, which I've mentioned already, or even allows patients to be treated in their own homes, which again, we stress should be, it's not, but should be a key component in any kind of budget, in any kind of plan, that of home care. So, Mr. Chair, this budget amounts to nothing more than a public relations budget. And the government is sitting back and hoping that the people will say, well, isn't this government great? They're putting more money into health care. Putting more money into health care all of the time. It's approaching $600 million more that will have gone into health care. But remember the Premier who said health care doesn't need any more money in Nova Scotia. Everything will be fine. It just needs better management. Mr. Chair, mark my words, we'll be back here next year with a large infusion for health, no plan that will enable government to shift the burden of costs from one component of healthcare system to another. We'll be back here with the healthcare system this time next year. The healthcare system will be no better. The healthcare system will be no more accessible as a result of this government's investment for wait times, Mr. Chair. And we'll be back here, or whoever's back here, year after year after year, no matter who it is. It may not be me, and it may not be the member for Dartmouth North, and it may not be any member in this House, but whatever members come back, they're going to be faced with the same kinds of problems, only worse, because it gets out of control. It's like a raging brush fire that no one's putting water on, and it will spread. And eventually, it'll bounce from the brush into the homes, and homes will be destroyed. And eventually, people's lives will be lost. I suggest all of that's happening already in our healthcare system, Mr. Chair. If we, Mr. Chair, what we've learned is that there are people who are still waiting unacceptably long periods of time for surgeries or for emergency departments, for family physicians, all of the things that I've mentioned. But what we learned here on our travel across the province in round times, a round table on wait times, that is, was pretty simple. And it was a message that came very strong, as I mentioned, from everyday Nova Scotians, people that you and I represent. The message was strong that you absolutely cannot continue to pour money into an acute care system and fool yourself into thinking that things are going to get better. The system is complex. I don't pretend to have all of the solutions or all of the answers to health care. The system is interrelated, something that I suggest the government has yet to figure out. I will suggest that part. And I hope that the learning experience of the minister and his tenure in his department has been as valuable as my learning experience here as a critic for health care. And I hope, Mr. Chair, that the minister understands that those closest to the system right now, the professionals, the administrators, and the public, they are all saying that without investments in other segments of the healthcare system, that you, Mr. Minister, or the next minister, the two previous ministers that were here under your government, you'll never fix healthcare. You'll never find the cure for what ails the healthcare system in this province unless you are willing to admit that there has to be a plan. The failure to plan has led this government, unfortunately, Mr. Chair, to just you pour good money over bad. That's all you do. Nova Scotians with $231 million are not going to be any healthier, and they are not going to be any better off with the healthcare system that this government is now offering. It'll be quite the opposite, Mr. Chair. So I would ask the minister, Mr. Chair, why he would continue to, what it amounts to is you're fooling with the people of Nova Scotia. This is a public relations exercise. This is day after day after day of news stories of people telling us and people telling the official opposition as well. All of the horror stories that have been in the newspapers over the past 5 years, over the past year or so, of people who can't access a healthcare system, of people who are not treated in a timely fashion. In this day and age, in this country, the minister, the leader of the official opposition, talked of the great Tommy Douglas, of Medicare, and what it meant to this country. And the minister warned, let's not think that it's free. Medicare, healthcare is not free. And I don't think anybody who is in dire need of health care, who walks into an emergency department, I don't think the first thought on their mind when they walk in and say, I need to see a doctor or a nurse. By the way, how much is this going to cost? In Canada, that's not the way that we think. In this country, the country of Medicare, that's not how we were brought up to think. We were brought up to think that Medicare, that access to health care is going to be there when you need it, without any hesitation, without any thought of how much it's going to cost. That's not for everyday Nova Scotians a problem to grapple with. That's a problem that governments and health ministers and staff, unfortunately, at health departments have to deal with on a daily basis. And no one's looking at them saying, you must come up with all the answers. You have to find a solution. But what people are saying, and again, I at the risk of repeating myself, what people are saying is that you cannot continue to pour money into this problem. You cannot, for instance, as the Minister of Finance is doing, and the Minister of Health, and the Premier, say, Ottawa, we need more money. Please, what's wrong with Ottawa? Give us more money. We need more money for health care. And then, on top of the fact that that's perhaps the wrong solution, turn around and say to Ottawa, we won't give you any guarantee that those dollars you give us are going to be spent on health care. You can't do that. Nova Scotians, as every Canadian, have an absolute right in this country to access to the best medical care that they can possibly get. Nova Scotia has a tremendous facility in the QE2, a tremendous facility that offers not only Nova Scotians, but offers people in Prince Edward Island, in New Brunswick, and other areas in the Atlantic provinces, the health care that has become known as only being available at the QE2. and only available in this province. And that healthcare system is in danger right now, Mr. Chair. The healthcare system is in danger of a total collapse unless we finally admit that first, before we throw that good money over bad, before we make the mistake of doing that again, that we have to come up with a sustainable plan, an action plan that is going to make it possible in this province to walk into an ER and be treated properly, to be treated properly in terms of how long it takes to get that treatment. As I said, not to be treated properly because the care is there. In most cases, the resources are there, with the exception of we have a serious nursing shortage in a lot of facilities in this province. And I think the minister is aware of that. It's another common thread that we found throughout our travels across the province in our roundtable on wait times. And among those common threads, nursing shortages, doctor shortages, wait times that are unacceptable. In some places, no services available whatsoever. In some places in this province, you cannot get the service of a psychiatrist. It's not right, but it exists. In other places in this province, you can get excellent care in terms of orthopedic surgery. In Cape Breton, the orthopedic wait time right now is probably a couple of weeks. That's pretty darn good. That's pretty darn good in this province. But if you take a trip in a car for 4.5 hours and find yourself at Halifax, you'll find yourself on an elective wait time list of 5,000 people at the QE2. 5,000 people. You will never catch up to that wait list. Never. That amounts to years of surgical time in an operating room and by doctors. And I would suggest to anybody of any reasoned thought that having 5,000 people plus on a wait list is totally unacceptable in the year 2004 in the province of Nova Scotia. Mr. Chair, I know that there's been somewhat of a correction in my time, that I now have about 4 or 5 minutes left. And again, there are a number of areas within the budget that I certainly intend to, when we come back during the next hour or whenever the case may be, that I intend to ask the minister. There are a number of areas in there that there are some gray areas there where we can get some details from the minister, and certainly I'll be asking him about the fact that administrative costs seem to be on the rise. We still have a problem with district health authorities. Though the minister made reference to the fact that most of them do have budgets, there are still district health authorities without a budget in this province. District health authorities in the past have waited over a year before they even get a budget. And Mr. Chair, how can you plan to financially run a district health authority when you don't have a budget for over a year? And there are many, many more areas, Mr. Chair, that we'll be bringing up during our time. But again, I think, and I don't mean, Mr. Chair, by no means did I mean to stand here for close to an hour now, and I hope it wasn't taken by anyone, in particular by the minister and his staff, that I'm standing here preaching what should or should be done. Mr. Chair, it's always a long shot for a politician to say this is a matter that we should not play politics with. This is a matter that goes far beyond politics, far beyond political lines. This is a matter of an individual's right to access medical care in this province. And when we see the problems, and we all know the problems that exist, we don't need surveys to tell us that there are long wait lists. We know they're there. Agreed, we need to measure those wait lists in a fashion that we can use to put together a formula to take care of them, to put together to get rid of those wait lists. That, agreed, is being done, and we needed to do it a long time ago. But at least there's been a start. But what we have to, as I said, admit is that there is a problem in health care. It will exist year after year after year unless we finally admit that it's out of control. We have to stop. We have to put a plan together that before we put another cent into it, calls for action on taking care of the problem itself. Again, and I think it's been widely accepted that the Romano report was a pretty good report in terms of what should and should not be done in health care. And to accept that report and to say that's exactly what Mr. Romano was saying, come up with a plan first, because you can't cure this problem by just throwing money at it. You cannot absolutely do that. It is not the answer. We have to find out, Mr. Chair, why this government has taken the road that it's now taking with health care, why it has ignored such things as home care, why it has not come up with a plan. Those are all, I would suggest, very logical questions that have to be answered by the minister during his time in budget estimates, and those are questions that are being asked right across this province, from one emergency department to another, from one stressed-out nurse to another, from one stressed-out lab technician, or whatever the case may be. Every healthcare professional across this province is now looking at this government and at the Minister of Health and saying, what are you going to do to solve this problem? And please pay attention to what we're saying. Put together a common-sense approach to health care. Make it work in this province once and for all so that we can be guaranteed 1 year from now, 10 years from now, that our health care system will remain in place. Thank you very much, Mr. Chair.
Thank you. The time for the Liberal caucus has elapsed. I'll now recognize the honourable member for Halifax Needham.
Thank you. Thank you very much. I welcome the Department of Health staff here to help us understand the budget in the Department of Health a bit better. The honourable member from Glace Bay paints a fairly grim picture. Parts of his dissertation I agree with and I accept, but there are parts that I don't agree with. And there are things probably I need some time to think about. But nevertheless, I think it's an important debate, and this is an opportunity not just to look at the actual dollars and cents, but the assumptions that are made in making choices about how to spend the resources we have in the healthcare system. Mr. Chair, I've had the privilege of being here in this place for a little more than 6 years now, and if the honourable member from Glace Bay thinks that there is no health plan today, he should have been here 6 years ago when I came here under the McClellan government. Because he sure as heck would have seen what lack of planning looks like. At any rate, here in the political arena, where health care is probably one of the most important and hottest political issues, we spend a lot of time debating health care issues and having discussions about health care issues.
Order, please. Order, please. The honourable member for Halifax Needham has the floor.
Thank you very much, Mr. Chair. So as politicians, there isn't anybody who isn't aware that health care is the issue that governments can rise and fall on, for sure. But I think, Mr. Chair, it's when we as human beings here in this legislature are touched personally, like so many Nova Scotians. It's when you're touched personally by the issues in health care that it really hits home why this is the #1 issue that Canadians and Nova Scotians care about. And Mr. Speaker, I had the occasion this year to be in that situation where a member of my family needed the health care system. And at that time, there were things that I learned about the healthcare system because of having a family member in the healthcare system in a way that really brought home the strengths and the weaknesses of our healthcare system. And I want to start first in the debate tonight by speaking to the strengths, because where I differ with the honorable member from Glace Bay in what he had to say with the grim picture he painted was that I don't believe our healthcare system is about to collapse. I don't believe that our healthcare system is unsustainable, and I don't believe that we are about to lose our system. I think that our healthcare system is an excellent healthcare system. It has a remarkable number of people who are absolutely dedicated to making this system the system of excellence that it is. And this doesn't mean that there aren't problems. It doesn't mean there aren't serious problems at times. It doesn't mean that all of the decisions that get made are great decisions. It doesn't mean that you can justify where expenditures are and aren't on every occasion. But I think we have to be very careful in the public debate around our healthcare system that we don't take a course where we speak so poorly about the system all the time that we hamper the morale of people who work in the system, that we discourage and undermine the confidence in people who are ill and require health care, and that in fact we create cracks in the system by our hammering of the system in a way that then the interests, for example, private interests that would like to argue that they can provide health care for profit in a more efficient and a more effective way, will come forward and embrace the opportunity to take over a system that we have created the perception around that it's broken. So I'm always very, very clear about the responsibility that we have, I think, as public figures and as elected people, that we try to enter into this debate about our healthcare system with some sense of balance, so that in fact at the end of the day we have a better healthcare system, a better publicly funded and publicly delivered healthcare system. And that is the objective that I have and the objective of members of the NDP caucus. So I wanted to say that. I wanted to say that when the situation occurred in my family this year, where a family member needed the healthcare system, very serious, life-threatening situation for this member of my family. Excellent medical care at St. Martha's Hospital in Antigonish. However, the care and the competence of the personnel in the hospital was what really made that experience such a positive experience for that member of my family. However, the problems that existed in emergency departments that we saw here in the Capital Region were fairly similar to the situation in the emergency room in Antigonish. And that is that there weren't beds in the facility itself, on the floors, on the wards, and many people who were coming in with severe illnesses had to spend many days, several days, in the emergency department. And in those situations, they had a lack of privacy. They had no place to have regular bathing and that kind of stuff. And, you know, the emergency rooms are not equipped to provide the same level of or supports that you would get if you were admitted to one of the wards in the hospital. So I think this is a very serious problem. A person who I know who worked for the Department of Health for a number of years at a fairly senior level in our bureaucracy here in Nova Scotia, who continues to work in the healthcare field, providing consulting services, once said to me that what goes on in emergency departments is like the canary in the coal mine. If your emergency department is in crisis and there are problems in the emergency rooms, then certainly this signifies that there are problems in the system as a whole. And I know that back in early January, when the healthcare workers at the Capital District and the Capital District at the QE held their press conference, and they talked about their frustration and the kind of crisis that was occurring in the Capital District, I know that there was a tendency to not, first of all, accept what they had to say as signifying, a reality. And the other thing is that there may be a perception today that that situation has been completely addressed. And I want to start with this because I don't think that situation has, in fact, righted itself, not by a long shot. I continue, in fact, in the last 2 days, I've had 2 different calls in my constituency office from family members who have had an elderly parent in the emergency department. In one case, an elderly parent who had been in the emergency department for almost 4 days by the time they contacted my office, and were waiting for a bed. And today, I believe the call was about a person who actually had been in the emergency room for a considerable period of time, had in fact gotten a bed, and now has been moved into a transitional unit, I guess, waiting for a bed in a long-term care bed. And you can see how these things connect as those cases come forward in my constituency room. So I want to start by talking to the Minister of Health around the acute care sector and the measures in this budget that his government is taking to address what are very serious problems in acute care and in emergency departments. I know that when I go through the health estimates, the supplementary detail books, and I look in each DHA, I see that what is forecast for the end of the year from the estimate for each DHA indicates that there's a deficit. And as you add the deficits up across the DHAs, and if you put the IWK in there as well, there is a considerable accumulation of deficit. Today, the Department of Health provided some information to the media about how the DHAs will break even at the end of this fiscal year and how much money the Department of Health has brought forward to make that happen. It's about $57 million, I believe. Yet when I look in the column of the department's estimates for the DHAs for the coming year, when I calculate whether or not in the coming year there has been an adjustment that will take into account the fact that the DHAs this year were unable to fall within their existing approved budgets, whether there was an increase that will accommodate the problems in this year's budget. I don't find it. I find that the DHAs are short a considerable amount of money. So I want to ask the minister, how will it be possible to avoid the kinds of situations that we have seen in the emergency rooms around the province? How will it be possible to ensure that the DHAs and the IWK will have adequate operating funds so they won't have to cut programs or go looking for ways to raise fees for parking and all of those other things that are being done inside the acute care facilities? Can the minister tell us what his plan is, how this will in any way, the estimates for the DHAs and the IWK, will it in any way give us the stability in the acute care sector that we really quite desperately need?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. I'm very pleased to have an opportunity to get to my feet again, and no doubt we'll be up a lot more often from now on. I first of all want to thank the honourable member for Halifax Needham for providing me with the cushion of time that she did relative to the comments from the honourable member for Glace Bay, and I also appreciate the fact that she does, while I'm sure she will find many areas that she feels are inappropriate relative to the budget. The fact that she does have confidence in the healthcare system, I think, is a very good premise upon which to base an analysis of where we're going, and it is in that attitude. Now, there's not everything that will be brought forward that I will necessarily agree with. However, it is, I believe, appropriate for us to be fair in our analysis with respect to what is good and what is wanting relative to the perspective that we all take to the process. In particular, to the honourable member's question, I want to point out that in the last year, relative to the DHA's budgets, we added an amount of $19.2 million, and this was added to the base, and that was to cover oncology and overtime figures, pressures that the DHAs were experiencing. So that $19.2 million is now added to the base of the DHAs. In addition to that, there is a $15 million which was transferred from the Department of Health to the DHAs. And for example, biomedical waste, mental health, Veterans Affairs Canada, additional therapists for early identification and intervention services for children with autism, and operating dollars for the bone densitometer for DHAs 2 and 4. So that additional money is also now part of the base. There was a $9.9 million that was transferred to the DHAs and the IWK for wage increments and benefits for healthcare workers. And that amount of money has also been added to the base. So the funding that the DHAs will receive in the year under examination now will be 7% over and above the additional monies I've just referenced that were added to last year's approved budget. And of course, those monies were to reflect the pressures that the DHAs were experiencing, and it was deemed appropriate for those numbers to be added to the base for the DHAs, so that the 7% is in fact a number that is added to those numbers I did mention. There was also an amount of $12.9 million that was added, and it's related to the classification costs for capital health. That number is not yet been incorporated as being held centrally because there are issues to be resolved around that particular amount of money.
The honourable member for Halifax Needham.
Thank you very much. Mr. Chair, should I be adjourning the debate at this time, or no, just, oh, okay. Oh, okay. Sorry about that. I was thinking about light debate. Okay, so, well, my next question then is a question about the fact that there seemed to be so little excess capacity